All right, thank you so much. And now that we are live, I'd like to say good afternoon to everyone again. And again, my name is Dr. Janet Johnson, and I'd like to welcome you back for the afternoon session. We are so lucky to have such a distinguished guest speaker with us today, and I want to thank Dr. Damian Dixon for making the time to be here to speak to us on the topic, understanding and responding to the trauma of COVID-19 through a health equity lens. But before I turn the podium over to our speaker, I would like to tell you a little bit about her. Dr. April Joy Damian Dixon is an epidemiologist, health service researcher, and classically trained public health professional with expertise in health equity, social determinants of health, psychiatric epidemiology, and mixed methods. She currently serves as the Vice President and the Director of the Weizmann Institute, a research, education, and policy center dedicated to quality improvement and primary care transformation, with a particular focus on vulnerable populations. Dr. Damian Dixon is also the immediate past chair of the Academy Health Public Health System, Research IG Advisory Board, and concurrently holds faculty appointments at Johns Hopkins Bloomberg School of Public Health and the UConn School of Medicine. Dr. Damian Dixon previously served as the Director of Quality Innovation at the National Quality Forum. In this role, Dr. Damian Dixon spearheaded the expansion of NQ's, the National Quality Forum's portfolio on social determinants of health, quality measures, and co-led the National Quality Forum Measures Incubator, an innovative effort that facilitates effective measures development and testing through collaboration and partnership, and addresses important aspects of care for which quality measures are underdeveloped or non-existent. Dr. Damian Dixon completed her PhD in the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health and Master's in Medical Sciences at Harvard Medical School. She graduated Phi Beta Kappa from the University of California, Berkeley, with a Bachelor's of Art in Ethnic Studies. Highest honors, she has worked with several reputable governing bodies, including the United States Department of Veterans Affairs, Veteran Health Administration in Washington, D.C., International Organization for Mitigation in Geneva, Switzerland, as well as local health departments on policy and programs relating to improving healthcare access and quality for medically underserved communities. She has received numerous recognitions in honor of her role as a social change agent, including the Harry S. Truman Scholarship, the Robert Wood Johnson Foundation funded Community Wellbeing Warrior Award, and an honorarium from the University of Delaware. Ladies and gentlemen, it is my pleasure to present to you Dr. April Joy Damian Dixon. Thank you. Very impressive. Thank you so much.
Good afternoon. Thank you for having me. That was quite a long bio. I was sharing not to read the whole thing, but appreciate it anyway. So for all of you who are joining via YouTube, thank you for joining this afternoon. For those of you in the room, hopefully I can keep you alert even after that very generous lunch. I was commenting, I hope the turkey doesn't put me to sleep in my own presentation. So hopefully you have candy at hand or something. I probably shouldn't say that, being this is the health ministry, but do what you need to do to stay awake now. Oh, water, yes, there we go, stay hydrated. So I usually do an overview of my presentation so you know what I'll be talking about. So I'll be going over the mental health impact of COVID, upstream factors, and I promise I'll explain any jargon that might be more understood in my field than in the society at large. So factors associated with mental health illness, example, trauma in the context of COVID. So I have different grounding frameworks because I want to make sure all the work I present is also grounded in science and in the data. And then a call to action, because Ernest said, don't just present the facts, but share some solutions, also some takeaways. So I know St. Augustine is not one to be shy about being called to action. It's something that Father Pat reminds us of often. So that's how I'll end my presentation. So I think it's important to know a little about your presenters anytime you go to a talk. So I am a San Francisco native, born and raised. And for those of you who've been to San Francisco or heard about it, probably the first images that come to mind are cable cars, Golden Gate Bridge, the best basketball team in the NBA this season. Or the Wizards are my second favorite because of my husband, but there's another side of San Francisco that you may be less familiar with, and which is actually how I grew up. And I thought that there was a great description of the neighborhood where I grew up in a recent article in New York Times, which I'll read an excerpt from to all of you. So it says here, quote, "The heroin needles, the pile of excrement between parked cars, the yellow soup oozing out of a large plastic bag by the curb, and the stained faux Persian carpet dumped on the corner. It's a scene that might bring to mind any variety of developing world squalor. But this is San Francisco, the capital of the nation's technology industry. Just a 15-minute away are the offices of Twitter and Uber, two companies that alone, with other nameplate technology giants, have helped push the median price of a home in San Francisco well beyond $1 million. This dichotomy of street crime and world-changing technology, of luxury condos and grinding, persistent homelessness, and the dehumanizing effects for those forced to live on the streets, provoke outrage among the city's residents. For many who live here, it's difficult to reconcile San Francisco's liberal politics with the misery that surrounds them. Some parts of the Tenderloin you're walking and you smell it and you have to hold your breath. It's obvious that it's a containment zone. These behaviors are not allowed in other neighborhoods." So to the far left, I think it's to the far left, is an image, a recent image actually, just a few feet from the studio apartment where I grew up. So you see that there's homeless encampments, illicit drug use. The middle is the daily washing of the streets. They didn't have this when I was growing up, but I guess they've put in a little more money because of the complaints. So my neighborhood was really poor, so poor that it didn't have its own public school. So I went to public school all my life, even through college before graduate school. It was a de facto system, and it might be similar here in DC, where it's local property taxes that fund public schools. So our neighborhood was too poor, and we couldn't have our own schools. So the closest schools were in the Mission District, which is the far right photo. So you can imagine on the bus, daily images I saw were you see candles and flowers, and probably neighborhoods you can think of in DC that are similar to this, where the site of shootings or fatalities. So I share all this with you, and on the bottom I put Dr. Jose Rizal. So both my parents are from the Philippines, and my ancestry gets a bit more complicated before that. But he said, "He who does not know how to look back where he came from will never get to his destination." And I use this same quote when I gave my commencement speech in undergrad, because I remember, even though I consider myself as a scholar and a lifelong learner of mental health and trauma, which is what I focus on today in my work, I have to remember I'm also someone who has survived and lived experience of trauma. And you always wonder, like, well, how do I end up doing the work that I do? And I have to recognize that my childhood and what I've been through also shapes. So I need to disclose that to all of you, so you know that I do come at this not only as a researcher or as a scientist, but also as someone who has lived through childhood trauma. So I shared that I want to go over the mental health impact specifically of COVID, because I was hoping, back in fall 2020, I think I gave a similar talk, and we were hoping by then the COVID pandemic would have been finished, but here we are, still in the middle of the pandemic, still wearing masks. So I want to share a few graphs. So it's really changed in terms of, if we're comparing January to June 2019 in terms of average share of adults reporting symptoms of anxiety disorder or depression, we really see how it's increased fourfold, right? From 11% to pre-COVID, and it's jumped to 40% January 2021, so less than a year after the start of the pandemic. And really understanding that the psychological impact of the pandemic will continue beyond once we get to a quote-unquote post-pandemic, but there's still mental health ramifications, as we've learned from other natural disasters, other pandemics that we've experienced globally. So I know we have some physicians in the room as well. So understanding not everything that's clinically diagnosed as anxiety or depression, not everyone will experience that, but some will experience symptoms, right? So like disturbed sleep, poor eating, restlessness, increased stress and worry. And we're seeing that these have also increased during the pandemic, right? Symptoms of anxiety disorder, depression, not being able to focus, whether that be in the classroom or at work, or having both symptoms, right, of both anxiety and depression. And I titled my presentation, looking at it through a health equity lens, because I want to make sure. There was a politician in New York who's been known to say that COVID is the great equalizer, and it's actually not. I'm going to say COVID has exacerbated but also brought to light health inequities that existed before the pandemic, right? And so you see here that people of color, so Latinx and African Americans specifically, are disproportionately impacted by symptoms of anxiety and depression. So it's broken down here compared to the rest of the U.S. population. And I do want to emphasize I'm focused largely on the U.S. here, not to say that we are in a pandemic, it's affecting the whole world. So just bear in mind that I'm focusing on the U.S. And I also want to bring into light in terms of essential and non-essential workers. So essential workers are those who, by virtue of their work, have to go in person, right? So you think of the people who are at our grocery stores, who deliver our mail, our sanitation workers, right? Healthcare workers. All of these different types of essential workers are at higher risk for symptoms of anxiety, depression, substance use, suicide. So all these three, in my field, we call the deaths of despair, and these have been on the rise already before the pandemic and have been made worse. And then we see that essential workers, who I had described earlier, are at higher risk during the pandemic. Some of that also, I should add, is not just because of the increased risks as they go about their day-to-day work, but also the potential risk that they're putting their family members and their loved ones, right? So the concerns of going home. I know some healthcare workers don't even share the same room. They'll probably like sleep in the basement or somewhere else. So just that ongoing fear or chronic stress. I do want to note, being mindful that St. Augustine, there are a lot of families, and we have a school within the St. Augustine parish. Parents are also concerned for their children, right? Can you imagine being a child growing up in the pandemic, the disruptions to one's development as a young person, not being able to play with your friends or having to wear masks in the classroom? So parents are reporting worsening mental health for their children, right, in terms of emotional health, symptoms of depression, anxiety, stress, right? I'm going to talk about this a little more, but in terms of learning online, right, and what does that mean when everyone, as I say, is in 2D and you're not able to really interact with your teacher, with your peers, as all of us who probably, unless you were homeschooled, and even then, right, we're able to interact with others, and how essential that is to interact with people, especially in your developmental years. I do want to note, I'm sorry that Father Pat and Father Steve had to leave, and Sister Viviana. There's also secondary traumatic stress, right? There's this thing that happens directly to you, right? The chronic stress, but also the emotional duress when you're hearing about the traumatic experiences of another person, right? So there's that. There's a secondary traumatic stress. There's also vicarious trauma when you're hearing those stories often, right? So a repeated exposure to the stories of someone who's experiencing traumatic events. And then there's burnout, right? So these are three terms that are common in my field, where you have a physical reaction to hearing these stories, right? You just feeling a sense of experiencing it through this person, even though you yourself may not have undergone that trauma. So who is most at risk? You can imagine healthcare providers, mental health professionals, clergy, social workers, lawyers, judges, human rights workers, journalists, right? So just different people who are hearing stories about the challenges that people are going through during COVID. So I will try to break down this image to you in terms of understanding chronic stress, right? And this is beyond COVID, but you can imagine, I don't have to convince any of you that we are living in a very stressful time. And so there's two different parts to this, right? There's chronic stress and how it manifests externally, and then chronic stress in terms of what's going on inside of us. So chronic stress can drive us on the left side of that image to overeat, to not be physically active, to engage in substance use or alcohol use, to not be able to sleep, and that can lead to allostatic overload, which I'll explain after I explain the right side. But there's also things going on internally, right? And it took years to understand, so I'm trying to break it down in very few minutes. But there's also things that are going on inside. So all of you probably are familiar with the fight or flight, right? So when there is a stressor, our body is responding in terms of our immune system, right? There's different hormones that are being activated. Over time, this leads to changes in our brains. And allostatic load, which I'll describe now, is essentially the different stressors, the accumulation of different stressors, right? It could be stressful events happening over a long period of time, or really major events, i.e. COVID, and it's just the combination of that. Allostatic overload is essentially when what is going on, these different stressors supersede, so environmental stressors supersede what resources are available to a person, right? Like just all these stressors is much more than I can physiologically be able to overcome on my own, right? And so that leads to all kinds of health challenges, right? Not just depression, anxiety, PTSD, but you think of cardiovascular disease, diabetes, right? It's just so much of Western medicine separates the neck up from the neck down, but really understanding that all of these are very much interrelated in terms of mental and physical well-being. And I'm preaching to the choir, as I know health ministry is very much aware of the mind-body connection. I show this image not necessarily to go over what I just discussed in the previous one, but to understand that there's also transgenerational transmission. For anyone who's working in maternal child health or understanding intergenerational trauma, which again, I probably don't have to explain to many of you. But these stressors, for example, think of a mother who's living through a period of COVID and what that might be doing to the children in their womb or the children that they're raising, right? So understanding there's also a biological basis for how trauma can also be transmitted intergenerationally, not solely from a social perspective, but also biologically in terms of the hits genetically. So now I want to go over upstream factors associated with mental illness, particularly trauma, since that's what I chose for today's talk. And I want to give this example, or this story rather. So in the mid-1800s, there was a cholera breakout in London, West End London. Dr. John Snow was a physician in London. He was seeing a lot of patients coming in for cholera, and he was wondering, where are all these patients living? So he actually created a map. And he found that all the residents or the patients that were experiencing cholera lived around what's this image, the Broad Street pump. And he thought, and this was a big breakthrough in my field of epidemiology, and he thought, well, rather than wait for the patients with cholera to come into my clinic, why don't we just turn off the Broad Street pump that is contributing to the patients experiencing cholera? I say this is a big breakthrough in my field in public health and epidemiology because it's essentially saying that it was not the individual patient's faults that they got cholera, right? Like there were circumstances beyond their control, the water pump, they were drinking water, that needed to be addressed, right? So in public health, we think of health beyond the control or agency of the individual and understand what are the environmental, historical, political, structural factors that are contributing to one's health, to their health decisions, to their health behaviors. So in this case, I want to understand, and this is what I focus on day to day, is what is water pump or pumps contributing to our current mental health crisis, right? We don't necessarily want to say, oh, it's that person's fault, they're depressed or they're anxious or they have a substance use problem, right? Very much of how we've finally, and not to get too political, finally understood the opioid epidemic as an illness and not blaming the individual as we have with other drugs, which is not the subject of this talk, but really understanding that there are factors beyond the individual, right, that shape their choice, that shape access, whether that be poverty, racism, xenophobia, sexism, homophobia, right, and how these different social inequities upstream, so to the left, contribute to choices or opportunities that people have in terms of where they live, what they get to eat, the type of employment that they have, and how all of those different factors eventually shape healthcare access, outcomes, even life expectancy, right? So that's really what I focus on because, again, understanding that it's not just the individual that shows up in clinical practice, but how do we look at healthcare? And thankfully, this is where the field is moving beyond the four walls of clinical practice to really promote health and well-being. So I say, like, what are the factors? So going back to that Broad Street pump, right? Like, what are the factors contributing to our current trauma and mental illness? For one, people don't have great access to mental health service, right? So we see that young adults, Black and Hispanic adults, women, mothers, that they've been negatively impacted in terms of their mental health and don't have access to the mental health services for various reasons, right? They couldn't find a provider, couldn't afford it, too busy, insurance doesn't cover it, or they were afraid or embarrassed to seek care, right? So really understanding there's also the stigma associated with seeking mental health services. So these are different factors that have contributed to barriers for seeking mental health treatment. I do want to note that during the pandemic, even though I worked on this 10 years ago, we've also had an increase in the use of telehealth, and some of you may have been able to use that. And I know some of you are joining us via YouTube, but really recognizing that the digital divide is real, right? Just because for some, it's saying that telehealth has expanded access, so you no longer have barriers in terms of transportation to see your provider. But really understanding not everyone has access to internet, not everyone knows how to use the internet, and that there are certain patient populations that are disproportionately impacted by the digital divide. And it's the same populations, right? People of color, older people, those who have lower education, those who are living with a disability. And then understanding also that, during the pandemic, which we're still in, there were emergency regulations that were passed to support telehealth, but that's also state to state, and some of those have been lifted, right? So not everyone can even use telehealth anymore because of certain policies that were put into place before but have since expired. There's also the stress related to poverty and economic insecurity, right? So COVID is a stressful time and impacts one's mental well-being. And I don't have to, again, this is something that you probably know just by, again, more common sense, but food insecurity, right? Having challenges with paying for rent, not being able to cover usual household expenses, or being unemployed. All of these different socioeconomic factors also contribute to mental illness. And I do want to note, again, because I'm focused on health equity, that communities of color are disproportionately impacted by the economic repercussions of COVID, right? We see Black, Latinx, Native Americans are disproportionately represented in terms of those who have lost their savings during COVID and have no savings to fall back on. There had been a ban on evictions, but that has since been lifted because it was only temporary, and also in terms of social support, economic supports. Some of them have expired depending on which state you're in. And again, we're seeing that communities of color are disproportionately impacted in terms of the economic aspects of the pandemic. And then we see that those who have lost their job no surprise, have more anxiety and depressive disorder during the pandemic, right? It's close to 20% higher than those who have experienced no loss in employment since the start of the pandemic. Oops. And then if we are looking at the breakdown based on income, those who worry or stress, worry, stress have related to COVID has had a negative impact on their mental health. We see again that those who are in the lower income brackets are disproportionately impacted by being worried or stressed, right? So no one can argue that the economic recession essentially that people are experiencing because of the pandemic is having real impacts on their mental well-being. This ties back to what I was saying earlier in terms of children falling behind because of the pandemic. But I want to highlight that, as many of you may already know, it's again students of color who are often, there's in terms of disparities in our education, and health and education, I say, are very much interrelated. And what is happening to our students of color who are falling behind the rest of the US population. This already existed before COVID, it's been exacerbated by the pandemic. Again, related to the digital divide of how can you learn from home or participate in classes if you don't have a computer, if you don't have reliable internet, if you don't have a parent or a guardian or family member in the household to help you manage these different technological devices, right? And so how do we make sure that children don't continue falling behind because of the pandemic? So Father Pat, one of the things he shares a lot is that we were made for relationship, right? Father, Son, Holy Spirit, God himself is also in relationship. We're in relationship with Christ. That's our identity as believers. So you can imagine the impact that this pandemic has on people who are quarantined or in social isolation, right? So about a third of the US population lives alone. This is not even related to the pandemic, right? And so what does it mean when you're forced to quarantine or forced to self-isolate? And initial research on this shows that loneliness, so right, the emotional distress associated with being physically alone, has increased by 20 to 30%, and that this is even more challenging for older adults, right? So on the other side of the life course, students, families, workers, others who are at risk. And then this period of isolation can have long-term effects even 3 years past the pandemic, right? So we're in October 2021, so think of 2024 of people still experiencing that emotional duress or distress, even after we get through the pandemic. I do want to note also the disparities in testing, infection, hospitalization, and death, right? So you probably already know that the data that's being collected in terms of race, ethnicity, and testing, hospitalization, and deaths related to COVID is not that great. We weren't collecting it from the start of the pandemic. So this is probably an underreporting. But even with the poor data that we do have, it does show that there are racial ethnic disparities in terms of who's getting tested, and once they do test positive, when do they get care? Communities of color, once they do test positive, not only have higher rates of infection, but also hospitalization and death compared to their white counterparts, right? So some of them requiring ventilation, hospitalization, needing higher forms of care after they're diagnosed. And I do want to note, because sometimes race and class are conflated and seen as interchangeable, and they're not, because this study shows also that even after controlling for socio-demographic factors, so in layman's terms, even after controlling for factors such as income, race still matters, right? So 3 in 10 people who know someone close to them who has died of COVID say that the pandemic has had a major impact on their mental health, either by knowing someone close to them, knowing someone who's died of complications, who's died of COVID, whether that be a friend or family member, of saying that it's had a major impact, right? At least 1 out of 5 people. During the pandemic, another part of the challenge for mental illness is because we're inside more, right? We have less interactions with other people, and especially for children, right? Usually children go to school, and if they're experiencing abuse in the household, at least they have teachers, counselors, different people who can see them and probably observe signs of abuse, right? But then understanding that these different schools or advocacy centers are seeing fewer children. Now, this is not to mean that less abuse is happening, right? It's just saying that those who frequently see them are not as able to observe them on a day-to-day basis, right? So children have fewer interactions with adults who might otherwise be able to identify abuse. I do also want to note my clinical colleagues are so busy vaccinating, right? And there's already a pre-existing shortage in healthcare professionals that when you have to divert those resources to either testing or vaccinating, we have even less resources to provide mental health services needed. So just understanding that our workforce, already strained, already burnt out, now has to redirect its focus to vaccinations and testings, which means less time to be able to provide mental health services. There's also virus-specific sources of violence, right? So intimate partner violence, right? So domestic. And this is not just, this can be any type of domestic partner relationship, right? So understanding that perpetrators of domestic violence or intimate partner violence can use misinformation, scare tactics, withhold safety items, right? Like hand sanitizers, disinfectant, PPE, withhold insurance or economic support. I show these pictures, so this is my natural, quote unquote, natural disasters, but I'm thinking that natural disasters that we're seeing in terms of the severity and the frequency are very much related to climate change, which is human-made, so it's challenging for me to say these are quote unquote natural disasters. But bear with me. So you think of, the wildfires that are happening in my home state, this image of earthquakes in Haiti, right? We have tsunamis, tornadoes just happening all throughout the US and globally. And just recognizing that we have these disasters happening on top of COVID, right? And just the ramifications that has on mental well-being. And one does not have to be physically or directly impacted by the fire or by the earthquake, right? So say someone living in San Francisco has family in Haiti, who's experienced the earthquake, right? And they're watching hours on hours of TV coverage or media coverage of the earthquake, compounded by not being able to get a hold of that family member, right? Because of, Wi-Fi is down, they're not able to get a hold of them by phone. So the emotional duress they experience and mental challenges that they're experiencing, even if they have not directly experienced the fire or the earthquake. We've also had human or man-made disasters, right? We finally had a mortal reckoning with 400-year-old system of historical and structural racism, which is not something that just happened when George Floyd was murdered. It's something that already existed, and we're finally coming to terms with that. Breonna Taylor, understanding it's not a Chinese disease, it's COVID, right? So understanding that the FBI actually has reported higher rates of experiences of discrimination and hate crimes experienced across all communities of color, and it ranges from 20 to 40% African American, Latinx, Native Americans, and Asians. So it's a lot, right? So going back to my talk earlier, we got a little scientific, a little nerdy about allostatic load, right? You have the pandemic, the economy, taking care of parents, children if you have them, the elections, right? We just went through elections, if you didn't remember. Just trying to eat healthy, not getting enough sleep, climate change. It's a lot, right? We're all experiencing this in different levels in different ways. But I always want to end with a message of hope, right? Because Ernest told me that we need to close that with a call to action. So one of my mentors wrote this article, Adolescent Mental Health, there's a vaccine for that, right? So you can't prevent, vaccine essentially, it does not say you will not get COVID, but hopefully it will offset the consequences on health if you do get COVID, right? So it just offsets it, right? So just understanding there's a vaccine for that, right? I'm not here to say this is how you can not get COVID or not get sick, not get depressed or anxious or have substance use. But there are things we can do to offset that, right? So the late great, and I won't call him a saint, but to some he might be a saint, Tupac Shakur, he was also a great poet, a great artist, and he had this poem called "The Rose That Grew from the Concrete." And he said, "Did you hear about the rose that grew from a crack in the concrete? Proving nature's law is wrong, it leaned to walk without having feet. Funny it seems, but by keeping its dreams, it learned to breathe fresh air. Long live the rose that grew from concrete when no one else cared." So I opened up by sharing that this is the San Francisco I grew up with, right? Like in the corner of the streets, people selling drugs, homeless encampments, seeing the smell of urine and human excrement, middle school, and just my years of formation, being exposed to different candles on the street because of my schools being in the center of gang activity. But this is St. Augustine Health Ministry Day of Recollection, right? And I would be remiss if I didn't say that my identity is not solely as someone whose lived experiences of trauma, but as Father Pat says, it's not just who I am, but whose I am, right? So understanding that throughout all of this, I'm a child of God, right? So, and one of the phrases in the Bible is "but God," right? Like all this trauma, all this chaos, people are hungry, there's slavery, all of this, but God, right? So I'm just acknowledging that in my own life, right? So this is an image of the divine mercy in the church I grew up in, St. Patrick in San Francisco. And on the bottom of the divine mercy was an inscription that said, "Jesus, I trust in you." And for some reason, I was always gravitated towards this image every time I had something big, whether it be being the first in my family to apply to go to college, or it be med school, grad school, all the years of school, moving back and forth, East Coast to West Coast, or leaving the country. And we actually had, Chris and I had this as our first reading, one of the verses in our first reading. It says, "Trust in the Lord with all your heart and lean not on your own understanding. In all your ways acknowledge him, and he shall direct your paths." So it's from Proverbs chapter 3, verses 5 through 6. So I say this because even though all the trauma I've been through, all the trauma we are experiencing individually, collectively, in different ways and for different reasons, that at the end of the day, I still recognize I am a child of God, and I've been surrounded by a support system. I grew up in the church. On the bottom left corner is my pastor growing up. And St. Patrick was very much like St. Augustine in terms of its richness in social justice, taking care of each other. Some of you in the audience have brought communion to my mom. Like, this is really our faith family, right? So understanding, and I have mentors and I have friends, and I've always known I was loved, right? And now I'm married, right? So my husband, I think he loves me. No, I'm just kidding. But recognizing that in spite of all these challenges, right, that what sets us apart as people of God is knowing but God, right? And knowing that we have hope, that yes, the pandemic is challenging. I am not going to sugarcoat it, but also knowing that as believers, we have a higher calling. I have a higher calling to not just rely on my research, but to say I come at this as a person of faith because I've gone through stuff. But now that I have the experience of being able to use that to serve others, right? So I've been able to have the opportunity to be trained at some very fine institutions. I've been able to travel the world in Geneva, serve youth in El Salvador and Haiti, only to come back to the U.S. because I was saying we have those issues of trauma too in the U.S., so serving in Boston. My dissertation that I did in Baltimore, now there's the Elijah Cummings Healing City Act in terms of training all frontline workers in Baltimore in trauma-informed care. And now I oversee a research education policy institute that's present in all 50 states, DC and Puerto Rico, and we serve over 400 practices with a focus on the underserved. And I put here from Romans 8:28, and we know that in all things God works for the good of those who love him, who have been called according to his purpose, right? Because I know that from my own lived experience. I may not have understood the trauma and everything I experienced growing up, but it eventually worked out in terms of God being able to use my test to give a testimony, not just to all of you, but to the children, the families, the communities I get to serve, the policies I get to inform. So I show this in terms of, this is something that really stood out when I was in grad school. Equipped with more resources, the effect from different life stressors is buffered, right? Because I talked about allostatic load and how if the different stressors you're experiencing outweigh what resources you have, then you experience overload, right? But what if we flip that? What if we equip ourselves, our families, our communities, our society with more resources? Then we can offset all the negative, right? Father Pat often says, you know, don't just forget about, but crowd it out, right? So how do we crowd out the darkness? In public health, we talk about the socio-ecological model, right? And I want to say, kind of like the Broad Street pump, that it's really beyond the individual, right? So how do we tackle this? Take personal responsibility, but also responsibility in our relationships, in our institutions, organizations, including St. Augustine, our community, and also in policy, whether it be a policy maker or you're involved in advocacy ministry, right? And speaking or challenging policymakers to move into action, right? And how we address this really varies across the life course. How we're doing it with kids will be different how we do it with adults, how we do it with older people, right? So understanding how can we be sensitive to the different needs of different populations. So different strategies that each person can do, right? How can we get better care of ourselves in terms of our diet, exercise, sleep, journaling, setting boundaries, relaxation. I know some people are into gardening, right? Seeking professional support, right? Like talking with someone. Like how do we normalize talking about our mental health challenges? If you have your own employees or staff that you manage, what does it mean to set boundaries with them, or to set boundaries even with your supervisor, learning how to leave work at work, right? Keeping a journal, setting goals, practicing forgiveness, right? Because mental health is also spiritual health, right? So there's practicing self-love, and what does that look like? So really understanding what does it mean to acknowledge mental health is not just what happens, again, in the neck up, but also in our physical interactions, our spiritual practices, what we do in our professional lives. I know some places have EAP services, so free counseling, and taking advantage of those services. There's also interpersonal, right? So I have a photo of the Knights of Columbus. I took some photos from the Irishmans. There we go. Because some of this is also how do we support the mental well-being of each other, right? And I was sharing with all of you that if it wasn't for, you know, the parish I grew up in, similar to St. Augustine, so St. Patrick in San Francisco, I would not be where I am today. Like that was really my safe haven in the midst of the chaos, right? So what does it mean for us to support parent-child or caregiver-child relationships? Social networking, right? Like St. Augustine was really great about this in terms of connecting people with each other, WhatsApp networks, right? So here, I mean, like the Knights of Columbus helping out, and this is with Team Hope, I believe it was at a breakfast, and I think the Sodality might have also been involved in the Health and Homebound and had a poster. This was years ago. But recognizing that that helps our mental well-being, right? Us being of service to others also in turn, and there's research to prove this, also supports our own mental well-being, right? Giving to others, we're also giving back to ourselves. And I have images here of St. Augustine Parish. I know Sister Viviana had to go, but St. Augustine School is part of the St. Augustine Parish, right? And Thanksgiving and the Christmas toy drives that we do. So what does it mean for us as a parish, those of us who are involved in community-based organizations, to promote youth development, right? So knowing that they're not just the future, but they're here right now. How do we help build their skills? How do we make sure that we're providing supports to our sisters and brothers who might be less fortunate than we are, right? It's not just, oh, come to St. Augustine, but we don't really care about your basic needs of food and shelter, right? Like, how do we be a church mission in motion, as I believe is on our bulletin, right? And understanding that we can play roles of referring our sisters and brothers to different services that they need. So this is what I had done in Baltimore, but essentially understanding like how do you approach it, right? It's not just what you do, but how you do it. So doing it from a place of safety, trustworthiness, transparency, supporting peers, empowerment, collaboration. If you were at Daily Mass today, we talked about humility, right? So understanding that these are the core principles of approaching the work. I can do this in a whole separate lecture, but you can ask me about that another time. Then there's policy, right? Some of you, I think maybe Lydia, so the Washington Interfaith Network, or WIN, right? We hear about advocacy ministries. St. Augustine does on its own, but also with other churches and faith groups across the city. So it's not just saying that, okay, I have a responsibility to meditate and to journal, I have a responsibility to my fellow parishioners, but it's also, we are also citizens and voters, right? And what does it mean to engage policymakers to say we need better social safety supports, right? This unemployment, paid sick leave, food vouchers, right? Extending permanent housing, promoting mental health research, right? Different ways to better allocate resources to create a more equitable society, right? So it's at different layers, and knowing that as people of faith, while we might not endorse particular person or persons, it's advocating for certain policies, because that goes back to this morning's session of Catholic social and moral teachings, right? So understanding we also have a responsibility, as it says here, faith, power, and justice. So with that, thank you for having me today.
For you. We'll get in contact later on about that, okay? One of the things that I did want to do is to, first and foremost, ask anyone, are there any questions that they may have in regards to our presentation for Dr. April Joy Damian Dixon? Go ahead, I'm sorry, Ms. Gloria. Okay, thank you so much. And George?
Yeah, I'd just like to ask, everybody in here is vaccinated, obviously, or else we wouldn't be in this room, but I think everybody in here also knows people who don't want to be vaccinated, who don't believe the science, refuse to go along. Is there any insights or advice you could give people like us who are approaching people at the other side?
Yeah. Mm-hmm.
Yeah, so this is I had to give a talk about this to providers in Central Valley, California. So we're not going to be able to convince the whole world, right? There's always anti-vaxxers. This is pre-COVID, right? Pre-COVID vaccine. There's challenges because initially it was because it was an FDA approved. It went through. It was just so quick in terms of being released to the public. But some of it is also what we share is, especially if you're in the healthcare space, to share your own story, right? Because so that's one, right? Like saying I'm getting the vaccine because I have loved ones who I care about, children, you have parents. Some people need a quantitative, right? The warm and fuzzies doesn't work for them, right? Sharing stories of saying I'm doing this not just for myself, but because I want to make sure I keep other people safe. But the numbers also show it, right? In terms of who's getting sick, who's getting hospitalized, and who's dying of COVID. You see higher rates among those who have not been vaccinated compared to those who have been vaccinated. We also show that people who get vaccinated, even if they get COVID, it slows down the spread, right, of COVID. So you can have this room, not to scare anyone in this room, and thank you for coming. But say if we're all vaccinated and someone happens to have COVID, it's more likely that, or I should say it's less likely that it'll spread because that person has had the vaccine and is fighting it internally as opposed to spreading it, right? So understanding that there's all kinds of material out there right now. And then some people you're just not going to be able to convince. And I've actually accepted that, right? Like there are just some people who will not accept. But hopefully through sharing your own personal story, as I said, one, sharing the facts in terms of hospitalization, deaths, and severity of illness from those who don't get vaccinated compared to those who do, and then also slowing down the spread. Hopefully you can share that with them.
I think you better stay close by.
Oh, okay.
All right. And just to piggyback on that, I'm a practicing physician in Maryland, pediatrics, and we do get a lot of parents that do not want to have their children vaccinated for various reasons, and then people who do not want to get the vaccine for the COVID vaccine. Like you said, we have to acknowledge that fact and just keep on and move on from there, but still offer them the science behind it and everything of that nature. And sometimes I always hit it with a little bit of a punch. One of my punches is this. I asked the children, where are you going after you leave me? McDonald's. So I turned to the parent. So you're going to feed them McDonald's, but you don't know what is in there, but you do know what's in the vaccine, and you won't give it to them. Okay? So sometimes you have to make it so that people can look at it and realize 100% of what you're actually trying to get them to understand. Okay? You had a question?
It's not a question. I want to make a comment because I didn't want to get the vaccination. I am really sensitive to vaccinations. I have been since I was a kid. Someone convinced me, I never got the regular flu vaccination. Someone convinced me one year, scared me into it, quite frankly. I got it, that's the year I got the flu. I never got the vaccination again. I've never had the flu again. So I never had it before or after. I am vaccinated or else I wouldn't be here. So I did get the vaccination, but I was like in bed sick for an entire week after my first one. And what I don't think is being addressed is that issue, that there are some, I know, while I was in bed, I was on the internet going, because I was at the doctor every day thinking that there was actually something else wrong with me because there's nothing, everything on the internet says, oh, you might have a sore arm for a day or two. So there's no recognition that actually there are some people. And when I finally talked to a doctor who was actually addressing what I had to say, he said women get much worse reactions than men generally, and it has to do with how good your immune system is. And the better the immune system, the more reaction you have. And I didn't want to get the second shot because I was so sick. And all they kept saying to me is, you have to, you have to, you have to, you have to. And then finally, they actually had a doctor come and talk to me who said, well, yeah, you know, it is important you get the second shot. And here's what you can do to potentially alleviate having really bad symptoms. And he told me what to do. I did it. I got no reaction to the second shot or the booster. So it's, you know, I don't think that part is really, I mean, I don't believe any of the conspiracy theories. There is no reason except that I'm really sensitive to them. And I think that there's some part of the population that is also there. So my comment is I think we really need to listen to, if there's somebody who's not getting vaccinated and we're not really listening to what can be done, then we're missing the point too. So anyway, I just wanted to say that.
Thank you.
But my friends were just like, you have to get it.
Any other, oh, Miss Angela.
I was just going to comment to share about the importance of sharing your stories and talking about your sensitivity to vaccines and potential allergic reactions. I also had a friend who was just, I'm not going to get it, I'm sensitive to everything, I'm not going to get it, I'm not going to get it. And I would encourage her, but not push. But it happened that she was having a conversation with another friend who had severe allergies. And she shared that I just went to my allergist and they tested a little bit of the vaccine on me. And I didn't have a bad reaction, so I went to CVS and got my vaccine. And then a light bulb went off in the other person's head, and they said, oh, I hadn't thought about that. I have an allergist. I can do that too. So sharing those stories, just your own and what you've heard from others, as you said, in kind of an open and non-judgmental way, can be very helpful to moving somebody along to where they need to be.
Exactly. Thank you. Any other questions, comments? And then Alice. Ben first, then Alice. Oh, Ben is a gentleman. Thank you, sir.
I just, thank you so much, April Joy. I just was wondering if those slides on interpersonal, all the things you can do to deal with trauma as the groups, if they could be available so we could really, remember all those things and practice and start practicing some of them if we're not already doing them. Yes. That's all. Okay.
Hey, thank you. I've had a number of people that are refusing to get the vaccination, and they have actually been told in depth, but they still won't believe because they're listening to some other people. Mm-hmm. Now, my dad passed last year, and we are certain that before he passed, he did have COVID, because the last time I saw him was through a Google Duo conversation that we had, and he was struggling trying to breathe. That he had not done before. I have a former coworker and friend who was coming by my place to help me on a regular basis, and the Spirit told me to ask him this particular time, have you had your vaccinations? Have you had all of your shots? And his response to me was, no, I haven't had any. I'm waiting to see what happens. There's over 650,000 people at that time in this country that had already died. So I don't know what you're waiting on, but I can tell you this. You will not be coming up into my space and jeopardize me. I have 6 doctors in my family, and the whole thing was, you don't go anywhere and you don't let anyone come in that you are not certain of. And I'm not trying to scare anyone, but believe me, the symptoms could be a lot worse had you not been vaccinated. I didn't have any symptoms with the first 2. I got my booster 2 days ago. The problem was I didn't listen to my body, decided I was going to walk like I had every day. I've been walking approximately 10 to 16 miles on a day. And I went walking on that Wednesday. I got about 3 miles out and I just felt something was not right. I turned around and walked the other 3 miles back to my home. And once I got in there, I felt like I was going to collapse. I called one of my siblings, who's a doctor, and explained what was going on, and it just felt like my head was going to explode with this. I didn't know what it was, but it was a drainage of some sort. And she told me not to take anything because it didn't want to mask some other things that may be going on, but to talk to my PCP after that if it still persists. So I'm fine today, but I just want everyone to understand that you're being selfish when you're not considering other people. And I make sure I explain that to folks because I don't want anybody giving me anything that I didn't ask for.
Understood. Okay. Any other questions?
Go get your booster. I had mine. If you can. A different matter. I noticed that you were talking about all the possible solutions to the problems that the growing problem. How is your institute tracking changes made on each level? You know, the community level, the state level, when they implement things to help people or services to help people. How are you guys tracking that regionally, or how's it affecting the anxiety levels and I don't know, I think.
Yeah, just to make sure I understand the question. So how are we tracking the association between changes in policy and availability of services with mental well-being? Yeah, so we track, so our clinical practices are mostly in Connecticut, although we provide training, technical assistance, and research support across the country. So internally, it's challenging because we had telehealth, and then because of the changes in policy, so we're actually seeing more mental health challenges, right? Because of the pandemic and just the different, as I was going over the social root causes. So it's challenging to say that there's an increase in use. There's definitely an increase in use of mental health services. So we know that access because of telehealth expansion is increasing, but there's actually recent data to show that certain populations, including communities of color, are not that either comfortable or would prefer in person as opposed to telehealth. And this just came out a few weeks ago, and it was one of those, this is not, we thought telehealth was the holy grail and it would help alleviate mental illness, and we're showing that actually people who need it most might not be using telehealth, whether that be lack of access or just not the preference. And I know it's also being tracked statewide, so the different graphs I showed, so Kaiser Family Foundation, they're based out in California, and you have a DC office, also tracks this in terms of states and relating to showing how different policies by states are also might be related to mental health outcomes. But it's just so challenging because I showed data from earlier this year, but we're coming up on 2022, so it's challenging because the data often lags behind what's happening in real time. So get back to me in 6 months, and I can probably give you another update.
And to piggyback on that, I find in my practice that when I do send people out, there are two things that they are concerned with. One, that they do not want to do telehealth, they want to actually see somebody. And then the second one is that they're not able to find people sometimes. And we can go through the insurance and everything of that nature, but it takes a long time and everything, so that it becomes an issue for me, so that sometimes I'm actually seeing people on a weekly basis just to make sure that they're still around and, getting somebody to talk to and, alleviate their fears. So do you have any input on that and how to address that? The other thing that I did have was, how come in our minority community, we were hit hardest when it came down to mental health, not only with our children, but also with adults? I needed to know and have an understanding of that before more ethnic groups that did not fall into that category. And then also, children have been greatly affected by this pandemic. What are your thoughts on how and on that, and how can we help them? Okay, thank you.
So I think I remember 2 of the 3, so you have to remind me of the first. But I think with the second, in terms of what is the rationale between the disparities in mental health illness in communities of color? I had gone over the different sides of upstream factors, right, in terms of communities of color, because of, again, 400-year-old institution of racism in the U.S., right? So poor access to education, contributing to poor access to better paying jobs, to health insurance, to being able to live in healthy neighborhoods, safety, right? Environmental justice, we had a town hall on that, right? So communities of color across the board, that's why I showed the earlier image of health equity. Across the board, fare worse than their white counterparts in all of those. And all of that is mentally stressful, right? If you're not eating well, you don't have, not earning a living wage, not having housing or can't provide for your family, all of this contributes to poor mental well-being. So I would say that, like, those different socioeconomic factors, and that communities of color are hardest hit because of the historical legacy of racism still rears its ugly head today. I think the second also, and I didn't get to share this, but we also have, and I can say that, you probably know this too, healthcare and public health, we have issues of discrimination and racism within healthcare. and I promise I won't lose my job saying this, but recognizing that we have our own biases in healthcare that need to be addressed, right? And that we don't necessarily, and we as in healthcare and public, don't necessarily make it friendly or welcoming for communities of color, and especially if, and my husband and I talk about this, especially if it's your first time seeking mental health services and your provider may or may not look like you or know what you are experiencing as a person of color, and how Dr. David Williams, actually out of Harvard, does a lot of work on race-related stress, right? So really understanding that there's that factor in terms of comfort and the lack of cultural competency within healthcare. There's also the stigma that we have to fight in terms of mental health. This is what was my dissertation in terms of some of it we've normalized. So I think about, and this is not just April Joy, the researcher, this is April Joy lived experience. We've normalized trauma, and I talked about intergenerational trauma intentionally to say, when you're used to several generations in your family experiencing trauma and mental health, I should say mental illness, you kind of normalize it over time, right? Like, oh, it's just that, you know, quote unquote crazy uncle, or they're just depressed, or just having a bad day. And we act as if it's that individual's fault. Or we don't trust the healthcare system, right? Issues of mistrust, because again, there's a racism in healthcare, like Tuskegee, Henrietta Lacks, right? I can go on in terms of why we don't trust the healthcare system. So mental health stigma, not trusting the healthcare system. There's also issues, I can go on and on about this one, but there's actually, I wanted to share a statistic earlier that there has been studies to show that in terms of comparing white middle-class woman, 20% higher chance of getting a call back from mental health provider compared to a lower class African American has a 1% chance. So even calling, so you actually got over, so even if you got over the stigma, if you got over the distrust, you finally make that call, you might not get that call back. Also in terms of our healthcare coverage, right, you have Medicaid, which is the safety net for low-income populations. You have Medicare, which is for our seniors and those with certain chronic conditions. Then you have private insurance. We have poor reimbursement in terms of Medicaid coverage for mental health and providers who will take Medicaid, right, compared to Medicare and private insurance. So again, we are communities of color more overrepresented in terms of uninsured, underinsured, and Medicaid coverage compared to private insurance. In terms of, so the third one, because I promise not to go, I can go on and on about the second one. The third one with pediatric population. I mean, I showed the image of St. Augustine and the kids there because I'm really invested in our school, not only because it's part of our parish, but because if you go into the halls of St. Augustine, you see images of African American leaders, right? And with like being able, and I always say this because also growing up, I've been fortunate because I also grew up more or less seeing some people, although my family identifies a lot with the African community, so that's another story for another time. But really being able to see positive images of people who look like you, right? So I know someone this morning had a question about saints of color, right? And what does that do for one's development as a child to be able to have positive role models and positive images? I talked about the importance of mentorship, right? Because I talk a lot, and most of my work also is to influence policy, but each of us can make a difference by being a mentor, right? Like mentors, in addition to my faith community, obviously my relationship with Christ, contribute to who I am today, right? If it wasn't for that mentor who took the extra time to talk with me, to help my family, right? So what does that mean for us to invest in those kind of relationships, right? There's also a whole science behind resiliency. So even if we can't overturn racism overnight, can't get rid of COVID tomorrow, that we can still build resiliency in the sense of hope. So I think we do that so much in terms of the programming at St. Augustine, but also really understanding the interconnection between health and education and how we really need to invest in both. I know in this country we tend to separate them. In other countries, it's a ministry of health and education, but hopefully really seeing how the two connect. And I'm sorry I forgot the first question. So you
I
have
think
to.
you answered it, believe it or not.
Okay.
Yep, thank you. All right, thank you again so much. It was very informative. They were just. Before we close, I do want to take the time to say thank you to the health ministry team, but also to the committee that was responsible for this retreat. Like George has stated, it was basically a few of them that got together, and I want to thank you, Ernest, for your technical expertise and everything for us. Okay? Thank you. All right, so in closing, I will offer a prayer in the name of.
It's not, Ernest, you're going to like this for me. I would like to see a follow-up where we really talk about specific things that we can do as individuals, maybe even look at all the ministries at St. Augustine's and see where there might be polls that address these issues.
Yes.
Okay.
Okay. All right, great, thank you. Oh, and thank you for bringing that comment up, and George for showing the evaluation. There has been an evaluation that has been passed to everyone. I please would appreciate it if you do fill it out, and everything of that nature. We do look it over, we read it, and then we actually make changes on our day of recollection and things that we do based on that. So again, I encourage you to put anything that you may want to see again on that evaluation. All right? Thank you. So we would end in prayer in the name of the Father, Son, and Holy Spirit. Amen. A prayer for healing, Father. Hold us in your caring arms. Embrace us with your life-giving love. Apply your resurrecting hands to our wounded places. It is your power that heals. It is your will that we live in good health as our souls seek you. Now, in our time of need, deliver us from our afflictions. Amen. And in the name of the Father, Son, and Holy Spirit, amen. Please do not forget to do the, the evaluation forms, okay? All right. Thank you so much.